Hello, I'm Dr. Caroline. I'll be your doctor today. I'm here to collect some information about your son. Is that okay with you?
Hello? Yes, I'm okay with that.
May I know what's your baby's name?
Ivan,
How old is he?
5 months old.
Where do you live?
Sunskate Street.
What are your complaints?
My baby keeps on crying.
Is there any vomiting?
No,
How is his appetite and nutrition?
he doesn't consume a lot of milk, so I would say his appetite is poor and low in nutrition.
Can you please tell me more about his stool?
He does not pass stool often and tends to be constipated.
Do you notice any weight changes?
Yes, he has lost some weight, about 200 grams.
Is there any changes on his appearance?
Yes, there is a mass at his scrotum and it has grown bigger over time.
What about his temperature?
It is normal in the morning and also in the evening.
Alright, now I'm going to ask about his past health history. When did you notice the growth in his scrotum?
I have noticed it since his birth.
Were there any trauma during delivery?
No,
Did you go to the doctor before this?
no, because it was small at first and I thought it would go away, but it grew bigger over time.
Is there any family member that has any health problems or issues?
Yes, my husband had inguinal hernia.
Does your son have any allergies?
No, I don't think so.
Did he take any medications?
Yes, he took antiemetics.
Which antiemetic did he take?
Ondansetron, I think.
Did he have any surgeries before this?
No,
How long did you carry the baby?
7 months. He was born 2 months before his due date.
Did you consume any alcohol during the pregnancy?
Yes, sometimes.
Did you smoke during the pregnancy?
Yeah, I smoke 1 packet per month.
Did you take any drugs?
No, I did not take any drugs.
Okay, I suspect that your baby has some malformations like a hernia, but we need to carry out further investigations to be sure.
What is a hernia? I would like to explain more about hernias. A hernia occurs when an internal organ or other body part protrudes through the wall of muscle or tissue that normally contains it. An inguinal hernia occurs fairly often in preterm infants. As you can see here, there are 2 muscles, and between it is a weak spot, in which abdominal contents could protrude or bulge out, causing a hernia. Inside the hernia is the intestine. Hernias can be complicated or uncomplicated. Hernias are dangerous because when the muscle contracts, it will cause bowel obstruction, leading to compression and constriction of arterial vessels that supplies blood to that part of the intestine, causing ischemia. If that particular loop of intestine dies, the intestinal contents like feces and bacteria will spread out into the abdominal cavity, leading to peritonitis, which is very dangerous. As seen here on the right, the scrotum is enlarged and the penis is small. The enlarged scrotum is caused by distended intestine, and when the baby cries, muscles contract, which increases the chances of bowel compression. In conclusion, the baby is suspected to have malformations as there are contributing factors such as smoking and alcohol during pregnancy. And also, the father has a past health history of inguinal hernia. The baby has an enlarged scrotum from the mother's complaint, has constipation, and has not passed any stool. Further investigation need to be done to confirm any diagnosis.
Hi, today I will be doing objective examination for the infant. It's a 1-month-old baby. Since we are dealing with an infant, we should take extra care and always wear personal protective equipment. Now I begin with general inspection. Glasgow Coma scale will not be used for children, but the chaotic movement of the child shows that the muscles are working and it's highly active. Eye movements are present in the baby and it's normal. and verbal response is good as the baby is crying and it's normal. The baby is conscious. The skin color of the baby is according to the race and it's normal, and there is no dryness and the skin is moist. Mucous membrane of the baby is normal, and the baby has poor muscle development due to malnutrition. Bones and joints are normal, and the baby is moving his leg and hands normally. Now I begin with respiratory system examination. There's no any signs of scars and wounds on the chest region of the baby, and the respiratory rate of the baby is 40, which is normal for a baby. The baby has normal breathing sound. Now I begin with cardiovascular system examination. Upon auscultation of the cardiovascular system, the baby has normal heart sounds. And the baby has heart rate of 120, which is normal for a baby. There is a special sphygmomanometer which is used to measure the infant's blood pressure.
The baby is conscious and moving normally. Upon inspection of the oral cavity is normal and the patient is not dehydrated. Therefore, it indicates that the intestine is not blocked. It is a non-complicated hernia. The abdomen is distended and it appears smaller. This could mean that the intestine has gone to the scrotum. Therefore, the size of the abdomen appears smaller. The skin of the abdomen looks normal and no bruises are present.
I was able to auscultate the gastrointestinal system of the baby, and there is peristalsis.
Upon examination of the local status, scrotum is swollen. There is mass localized in the scrotum. It is partly movable as the intestine is not fused to the hernia. The consistency is partly soft. Size is about 15 centimeters. The temperature is normal as there is no inflammation, and skin color is normal. Pain is present based on the cries from the baby. Shape of the mass is round and it is single bilateral mass. There is protrusion of the mass. Upon auscultation, there were present of bowel sounds and peristalsis. And the functional test is negative as there is no fluid. Digital rectal examination is not indicated for the patient.
Hello madam, I am Dr. Atira. Thank you for waiting. So we already did the examination. As for now, we got that your baby has inherent hernia, which is inguinal hernia. It is bilateral and non-complicated.
What is inguinal hernia and how does this happen?
An inguinal hernia usually shows a bug in a scrotum. Before birth, a male baby testicle grows inside his abdomen and then travels to scrotum to get to scrotum. The testicle must pass through two openings called internal and external inguinal canal formed by abdominal wall muscle. As the testicle enters the scrotum, tissue lining the abdominal wall comes with them forming a sac. Normally, the opening of the sac into the inguinal canal closes within 6 months after birth, but sometimes for unknown reason, the opening of sac does not close. As a result, the open tissue sac may fill with fluid that normally stays inside the abdomen. The fluid-filled sac surrounding the testicle is called hydrocele. A small piece of the baby's intestine or some fatty tissue from the abdomen may also slide into the sac, resulting in what we call inguinal hernia.
Doctor, how dangerous is it?
The compression and the constriction of the arterial vessel which supply blood into the hernia will happen and leaving intestinal in ischemia. The loop of intestine will be dead and all intestinal content will spread out. Feces and bacteria will spread to abdominal cavity, lead to infection called peritonitis. So it is life-threatening and really dangerous for your baby.
What shall we do now, as I am so worried about my baby?
To 90% I am sure it is hernia, but another 10% it could also be anything else such as tumor of testis or tumor of scrotum or fluid in the scrotum. So in order to make it sure that I am right about the inguinal hernia, we first of all have to confirm the diagnosis with the help of laboratory and instrumental examination. Only after the result were obtained, we can proceed with final diagnosis and further medical treatment. Is it okay with you?
I am okay, doctor. Thank you.
Lab and instrumental diagnosis. CBC is done. Urine test, blood chemistry, research test, AIDS and COVID test is done. CBC will be normal. No leukocytosis, no anemia, ESR normal. For instrumental investigation, ultrasound of the abdomen and scrotum is done to find out what is inside. It may be just fluids in scrotum, not intestine. No need of gastroscopy, endoscopy. X-ray of the intestine is done by barium swallow.
Okay, so after all the investigation and the tests that we have done towards your baby, we have come to final diagnosis that your baby is having inguinal hernia. So as for the treatment plan, we will put your baby in supine position, and then for his diet, it will be normal diet for now, and then we won't be giving any infusion therapy yet, and we will give your baby analgesics because it is to relieve pain from your baby, and as for the analgesic, we will give rectal suppositories, and also we will give your baby growing binder, which is the umbilical hernia belts for babies. And then for surgery, we recommend you to do that because we want to prevent any complications from happening. The surgery is absolute, and since your baby is not in any emergency condition yet, we will prepare your baby in 5 days for the surgery, and then we will also continue to monitor your baby during these 5 days to see if there is any complication. And the kind of complications I'm talking about is the compression and constriction of arterial blood vessels that supply the hernia could happen, and then it will lead to intestinal ischemia, which is what I mean by intestinal ischemia is the loop of intestine could be dead, and it will spread out the intestinal contents such as feces, bacteria into the abdominal cavity, which then will lead to bacterial infection called peritonitis, which will worsening your baby's condition. So we don't want that, and you don't have to worry. We will continue to monitor your baby's health, and we will give our best in delivering the suitable treatment for him.
Hi, doctor. Hi. So are you Ivan's mother?
Yes, I'm Ivan's mother. Well, I'm here to ask you about the indications of the surgery.
Indication of the surgery. So regarding this indication of the surgery about your son, it's an absolute surgery, madam, but it's not a very emergency surgery.
I see.
In my point of view.
I see.
Yeah.
Okay. What type of surgery are you planning on to do on my son?
It's urgent. Since he's very he's just 1 month old. This is urgent surgery to avoid any further complication in the future, madam.
I see. What surgery is it? What is the surgery called?
The surgery is called herniaplasty, which means the type of hernia that is repaired through surgery. Yes.
I see. So since he's very young, right? And I believe that you plan on putting anesthetic on my son. What is the plan for the anesthetic since he's very young?
So regarding, since Ivan is just 1 month old, we have planned a general anesthesia for him, which means he will sound asleep during the whole entire surgery. He wouldn't feel uncomfortable. He will be very comfortable with his surgery. Nothing to be worried about.
Alright. Okay. I'm also concerned about the risk of the surgery.
The risk of surgery is he will have a very mild embolics, which means there will be blockage in the vessels. Why is it mild? I'll tell why is it mild. It's because Ivan is still very young. He's just 1 month old, and he does not has any previous disease, existing disease, and his condition is very normal. So he will have very low, mild thromboembolism. And then anything else that you want to know? The risks.
What are the risks of the bleeding and also the surgery? What is
everything? Since he's very young and he's still very small, the risk of bleeding in surgery will be very mild, madam. For now, it will be very mild because it's a very minor surgery that's been done on him.
Alright. There's also another question. Since he has to perform the surgery, right? Let's just say if he doesn't, or if he does, what are the rate of the surgery with and without?
So if you choose not to have surgery for Ivan, the surgery without surgery, the recovery rate will be 0%, madam.
Right.
So with surgery, it will be 90%, and there wouldn't be any complication if you have surgery, and the success of recovery is also will be very high.
I see. Alright. Okay, so I will discuss with my husband, and then I'll come back and tell you our decision based on the surgery.
Yeah, sure.
Alright.
Thank you.
Thank you. Hello, doctor.
Hello, madam. So can I know what is the decision that you have made regarding Ivan's surgery?
So my husband and I have decided to go on with the surgery. So yeah, we will plan on.
Any other question that you would like to ask me before the surgery is being held?
No, so far no.
No concerns, no worries about the surgery, right? So madam, I just need you to sign this consent form regarding Ivan, and we will, once you sign this, we will proceed with the surgery.
Alright, thank you.
Okay, madam. Thank you.
Thank you. See you.
During pre-operative checklist, the baby will be taken his vital signs with his mom aside. Everything is normal and is ready to enter the surgery room.
Surgery is the only treatment we have so far to treat an inguinal hernia. There are two options to treat an inguinal hernia, and those are the traditional one, open surgery, and the second one is the laparoscopic surgery. Laparoscopic surgery is a minimal invasive surgery. We need to diminish not only the size of the scar, but we try to diminish the aggression to the tissue. It's very important to have an agreement with the patient in the clinic. When we have a patient with a unilateral inguinal hernia, we offer an open approach. And when we have a bilateral inguinal hernia, we offer a laparoscopic approach. Meshes played a very good and important role in the hernia surgery. It was a revolution. A mesh is a net. It's like, in the construction, it's like the steel. All the builders, the constructors use the steel and they put the concrete. What we do is to put that steel, that's the mesh, the analogy of the mesh, we put that mesh there to reinforce that area, to create a stronger tissue, but the concrete is made by the patient. And that concrete grows through these small holes that the mesh has in it. The open procedure can be performed under local anesthesia and sedation. Laparoscopic one has to be under general anesthesia. This is the main difference between open and laparoscopic one. We perform a skin incision. We dissect the tissue until we reach the fascia of the major oblique. We open that fascia. We identify the nerves. We identify the spermatic cord. Then we dissect the sac, the hernia. We have two chances, one to remove the sac and the other one to reintroduce it in the abdominal cavity. And then we close the hole with a kind of mesh. We fix the mesh with a suture. We close the fascia with an absorbable suture over the mesh. We close the subcutaneous tissue, and then we close the skin.
During the surgery, the anesthesiologist will monitor the vital sign of the patient. The pulse, respiratory rate, blood pressure, temperature, and skin are all normal. The general anesthesia medications such as ketamine, propofol, fentanyl, and droperidol are used to keep the patient from feeling pain during surgery. The infusion therapy also will be given, which consists of normal saline solution, dextrose 5 solution, packed red blood cell, and fresh frozen plasma. These solutions are given to replenish the electrolytes and blood loss during the surgery.
During the postoperative period, the vital signs of the baby is measured. The body temperature is 36.8 degrees Celsius, blood pressure is 95/58, pulse rate is 120, and respiratory rate is 60 breaths per minute, which is normal. On inspection of the skin is normal and there were no discoloration, cyanosis, or jaundice. The drains inserted during surgery is also inspected. The drains are clear and normal. The urine output of the baby is also measured and is found to be within the normal range. During the post-operative monitoring, the baby is also found to be conscious and not crying. As for the baby's diet, he will continue with breast milk from the mother as the main source of nutrition and to avoid dehydration after surgery. The baby will also be administered some medications such as antibiotics and analgesics, for example, ibuprofen to relieve pain. Laboratory and instrumental investigations are repeated again during the postoperative period, for example, an abdominal X-ray and ultrasound. Complete blood count and blood chemistry analysis is also repeated and the results are all normal.